Till date, the notion has been people can acquire novel coronavirus if they come in close contact with an affected person or objects contaminated by a COVID-19 positive. But a new study has turned this notion upside down. According to a new study from National Institutes of Health, CDC, UCLA and Princeton University scientists published in the New England Journal of Medicine says, results provide key information about the stability of SARS-CoV-2, which causes COVID-19 disease, and suggests that people may acquire the virus through air and after touching contaminated objects. The scary results it shared are: the novel coronavirus is stable for several hours to days in aerosols and on surfaces. What are aerosols? An aerosol is a suspension of small liquid droplets or solid particles in air. The aerosol material exists in the liquid or solid state and is carried by the air into the respiratory tract. The study says scientists found that severe acute respiratory syndrome, coronavirus 2, that is SARS-CoV-2, was detectable in aerosols for up to 3 hours, up to 4 hours on copper, up to 24 hours on cardboard, and up to 2 to 3 days on plastic and stainless steel. Scientists have come to this conclusion after a mimic virus deposited from an infected person onto everyday surfaces in a household or hospital setting, such as through cuffing or touching objects. And they then investigated how long the virus remained infectious on these surfaces. The study also listed subtle differences regarding why the SARS-CoV-2 is infecting more than SARS-CoV-1. Scientists say if the visibility of the two coronaviruses is similar, why is SARS-CoV-2 resulting in more cases? Their observations are, emerging evidence suggests that people infected with SARS-CoV-2 might be spreading virus without recognizing or prior to recognizing symptoms. This would make disease control measures that were effective against SARS-CoV-1 less effective against its successor. In contrast to SARS-CoV-1, most secondary cases of virus transmission of SARS-CoV-2 appear to be occurring in community settings rather than healthcare settings. However, healthcare settings are also vulnerable to the introduction and spread of SARS-CoV-2, and the stability of SARS-CoV-2 in aerosols and on surfaces likely contributes to transmission of the virus in healthcare settings. Now, the Indian scenario. As per latest bulletin, total active COVID-19 cases means hospitalized cases in country stood at 130. However, total cases reported stood at 147, which includes 14 cured, discharged and 3 mortalities. The breakup data shows Indians with NCOV totaled to 122 and the foreigners count stood at 25. What is the evolving COVID-19 scenario in India? An analysis of the data reveals more significant inferences. Consider this. COVID-19 mortality rate in India at present is 2% and recovery rate stood at around 10%. An analysis gives big hints. Look at the graph. India reported first case on January 30. Till the 4th of March, the country has recorded mere 6 cases. But first big spike happened on March 4 when on a day the country reported 23 new cases. However, it takes 6 long days to touch the 50 mark on March 10. It took a disconcerting turn since March 15. Rapid rise in new cases stands testimony to it. 14 new cases on March 15, 11 on March 16, 19 new cases on March 17 and 12 new cases on March 18 till morning 9 am. Another big analytical inference is the last case showing recovery from COVID-19 in the country has been on March 7. During March 8 to 18, no new recovery case of COVID-19 has been noticed. A big sigh of relief, however, is since January 30, none of the above COVID-19 patient has been under intensive care. Intensive care patients means patients developing serious complications affecting vital organs. The above inferences show COVID-19 cases are on the ascent in the country since last week. So, has it entered into the level of community transmission? Only yesterday, the Indian Council of Medical Research has denied of NCOV acquiring community transmission in India. The apex research body said so on the basis of nearly 500 samples of 1020 with influenza-like illness, that is ILI, and acute respiratory infection, that is ARI conditions, reporting negative NCOV. However, results of another set of over 500 sample will be declared today. Today's results may put a stamp of approval that COVID-19 hasn't acquired community transmission level in the country. The Odisha scenario says 47 is done, 1 positive tested and given treatment in isolation ward, but not under intensive care. 53 quarantined and under observation, though none has yet shown flu or pneumonia-like symptoms. 12 samples sent for test, all negative. The history of COVID-19 shows the chances of acquiring the disease is high if one has any close contact with a viral shedding COVID-19 positive case. So only time will tell the future COVID scenario in Odisha.